The United States, we have the highest rates of maternal mortality in comparison to all affluent nations across the world. Maternal mortality is often viewed as an indicator of the way society treats its individuals and the way society treats its women.
Black women in this country have a much higher risk of death and pregnancy complications. And here in New York City, that rate is even higher.
Haitian women are more likely to suffer from severe maternal morbidity and mortality in New York City.
And the rate of severe maternal morbidity is almost 4 times higher than the national rate overall.
And many things go into that. Do women and family have the healthy grocery stores? Do they have transportation that's nearby? Or is there more pollution within their communities? Do our hospitals and health centers here in Brooklyn have the same resources that they have in New York City? We see the barriers, we see the challenges, and we felt that this was not being addressed, and unique programming was not being developed for a community that has both language and cultural barriers.
And it seems like sometimes Haitian women can be forgotten in the healthcare system just because Haitian Creole is not a language that has been accounted for, even though there is a sizable Haitian population.
And that's the reason why we started the Haitian Women's Birth Equity Initiative.
We have these support groups where we talk about what are the important questions that we ask the doctor now that you're pregnant or postpartum or planning to have a baby. What should you ask?
To be able to be that bridge so that they have access to all the same resources, they have educational programs, the counseling, all the information in a welcoming environment, in a language that they understand, to ensure not just the access, but the dignity and the comfort that all people and families deserve.